Good evening and welcome back to The Woman Factor. I'm your host, Erica Bourgeois, and tonight I'm joined by Dana Rogers from the TGMC Breast Imaging Center. TGMC Women's Health Center provides comprehensive and advanced breast imaging care for women right here in our community. With the implementation of 2 breast imaging technologies, 3D mammography, and dense breast tissue screening with the automated breast ultrasound system, early cancer detection and diagnosis is made possible. Joining us today to tell us more about the advances is TGMC's Breast Imaging Center technician, Dana Rogers. So thank you so much for joining me. And now I know that you do mammography and you also do quality control for your department at TGMC, so that's a pretty big deal. Can you tell us a little bit about yourself and your role with TGMC?
I've been with TGMC for 18 and a half years, and I do mammography, I do ABUS, I do bone densities, I do biopsies, and I do quality control.
So you've got a lot on your plate.
I do.
And so now, why is mammography important for women's health?
Breast cancer is one of the most leading things that are complicated for women. This is a concern. It's always been for strictly women, and mammography helps early detection in breast cancer. Having a mammogram on a yearly basis can actually help a woman prevent advanced cancers from being even worse and conserve breast tissue if you're able to find these cancers in a early stage. Right.
And so now at what age do you guys kind of suggest that women start getting these mammographies?
Definitely 40. 40, the typical is 40, but we always let our patients know that they always have to go by what their physicians say.
Right.
Typically it is 40. You start at 40 and have one every year.
Okay. And so now what is the 3D Synoclare and what is the patient's benefits? Am I saying that right?
Yes, you are.
Okay.
A 3D Synoclare, which is better known as 3D tomosynthesis.
Okay.
Probably more people know it as 3D in the outside world. It is the latest and greatest technology that allows us to take images in slices of the breast instead of just a regular 2D mammo.
Wow.
And its benefit is going to allow the radiologist, since it's taken extra images in different planes, it's allowing the radiologist to be able to see around and in between from skin to skin on those images.
So that actually gives them the opportunity to pinpoint the exact location, really, right?
Yes, it does.
Well, that's great. And so now, what is the patient experience of the 3D mammogram?
The patient's experience should be that of a traditional 2D. A traditional 2D, your breasts are put into compression, and your breasts are still going to be in compression for the 3D. The typical compression that a patient has to go through is pretty much the same. Same strength. You may be in there for maybe about 3 to 5 more seconds. But what we do as techs, we put the patient in position to take a traditional 2D mammo, and we leave them in compression. So they're going to stay in compression until we click a button, and then once that button's clicked, it actually takes a series of images for the patient before it's actually released. So the comfort level, I think it's kind of individual.
It's on an individual basis.
Yeah,
it really
it's
just
on an
depends.
individual basis. I mean, you are in compression for about 10 to 15 seconds maybe.
Yeah.
But the positioning is the same. Completely the same.
So it's not something that would be out of the ordinary for them?
The exam takes anywhere a little bit longer because we do have more images. So it may take anywhere between 5 to 10 minutes more.
Well, that sounds pretty high tech.
It is.
And so now TGMC also offers ABUS or automated breast ultrasound systems. So who should get this screening?
It's ABUS, automated breast ultrasound screening. ABUS is density specific. In our hospital, we actually have some software. It's called Volpara. Volpara is like when we do a mammogram on a patient, it goes through a system and it actually picks up how dense the breast is. Those sections, they're labeled with the alphabet, actually.
Okay.
And that's how we found out who can have the ABUS.
Okay, so you have to be kind of like specially picked for this.
Yes.
Okay.
Volpara will puts an alphabet on it. Like an A breast would be somebody that it's their breast or fatty replaced.
Okay.
A B breast would be somebody that has scattered fibroglandular densities. A C breast would be someone with heterogeneously breast dense breast, and D breast would be extremely dense. And the only two people that can have that ABUS would be someone with a C or D breast, which means that they have dense breast.
Wow, and so this is kind of like a very specific screening, right?
Yes, it is.
And so now how does the ABUS screening work? Is that how it works?
Actually, you would have the mammogram.
Okay.
It would pick up how dense your breasts are, and we go from that, depending on what category you put in.
Right.
The actual test in itself takes about 15, 20, 30 minutes. It just kind of depends. But the patient's actually laying down for this test. They're lying down on their side, and we use lotion for the test. Actually, lotion goes all over the breast. And we put a large transducer where a normal ultrasound transducer is little bitty.
Okay.
This is like about that big. It's a transducer that goes firmly on the breast, and it actually scans the whole breast at one time.
Wow.
Each breast gets about 3 to 4 images per scan. So it could be a lengthy exam. It just kind of depends. I would say 20 to 45 minutes, just depending.
And there's no typical characteristics. Like you can't, look at it and say, oh, well, I think this might be a C. Like you have to have
From the naked eye?
Yeah.
No, because you can't. You have to have
You have to have it.
a heterogeneously dense breast or an extremely dense breast.
Wow. And so now, what is the patient experience with ABUS?
Exactly what I told you. They would lay down.
Lay down.
They would lie down. They would have lotion on their breast, and a big, large transducer would come on. Like we would be doing it, and we put it firmly on their breast to take the images.
Okay. And so there's no compression on this, right?
Very minimal. There is something on the machine that we actually click to make sure that the whole transducer comes into compression with the breast, but it's nothing like a mammogram.
Right. So it's a lot more comfortable.
Yes, it should not. You should not have the same discomfort level as a mammogram for the ABUS.
And so now, when should women receive their annual mammogram?
Their annual should be starting at 40. It should be starting at 40, unless we do have some patients, their doctors want them to start at 35.
Right.
And then start again at 40. It just kind of depends on your physician, but it's typical to have 40 and up.
Now, do you find, I know like cancer is kind of advancing, you're finding out younger and younger people are getting it. Do you think there's a such thing as like a high risk, a younger adult that would need to get mammograms? Or
Definitely. Someone with a very strong history of breast cancer, someone with a mother that had it premenopausally,
okay,
a sister, a daughter that had it premenopausally, they would actually start a lot earlier than 40. For instance, if a mother had breast cancer at 45 and she was premenopausal and she had a daughter, her daughter would start it 10 years before. So she would start it at 35 and vice versa.
Yeah.
We do have some 25 and 30-year-olds that come in because their parents had breast cancer at an extremely early age.
right. And so, that's a good bit of information to know because, I feel like it, especially in this area, I feel like you hear a lot about breast cancer and a lot of people, fight with that. And so I think it's good to know when you're at high risk and what are the, what makes you high risk. And so now, is there anything else that you'd like to add?
Not particularly.
Just go get your annuals, huh?
Yes, definitely. Speak to your doctor. Find out all the information. See if you qualify to have a 3D. And an ABUS. You won't know till you actually have your mammogram. I will say that a mammogram and an ABUS have to be in conjunction together.
Right.
You can never have just the ABUS by itself. The mammogram can always be done by itself.
Okay.
As a screening tool, but the ABUS cannot. And if you do qualify for that ABUS, of course, always check with insurance. Make sure it's approved.
Yeah.
And we want it as close to having that mammogram or in conjunction with the mammogram. That way they can be read at the same time.
And, you know, I mean, like you said earlier, it takes, what, like 15, 20 minutes for each. So, I mean, you could cut out on your lunch hour and go get your annual.
An hour, typically. A mammogram, a typical mammogram takes anywhere between 10 to 15 minutes. And the ABUS takes a little bit longer, just depends on how many images we have to take.
And so just staying informed is really the main thing. And so now to see if 3D mammogram or ABUS screening is right for you, visit tgmc.com or speak with your physician. So don't go away. We've got more on the Woman Factor. Up next, we've got Miss Arlonda Williams, the Terrebonne Parish Council Chairwoman of District 2. And she is going to give us a couple of district updates and tell us a little bit about more of what is going on in the community. And then we'll also be joined by Heather Benoit and Kim Thompson from Moms of Hope organization, and that is going to be about Pregnancy and Infant Loss Awareness Month. So thank you so much, Dana, for joining me, and I'm very glad that you got to inform people about breast cancer, because I do think that this is something that older women, you know, people need to get checked, and they need to have their annual mammograms, and that is important. So don't go away. We'll be right back.